Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we have a great show for you tonight, but before we get into the meat of the show, I want to talk about caring and sharing. You caring about yourself so that you can do better health-wise. So, hey, listen, my goal for everybody out there is that you to live to 90 years old. And guess what? I want you to be healthy until 90 years old. So as long as you live, I want you to be healthy. And the way you can do that is make sure you keep up with your health, see your doctor, eat right, make sure that everything that you put in your mouth as a morsel of food or anything, make sure it's healthy. All right? Because that's what it's all about. We are what we eat. Okay. Our website, obeyyourdoctor.com. Believe me, it's got so much health information on it. Just go to it. You'll understand what I'm saying. Obeyyourdoctor.com. And we're on Facebook and Twitter and Instagram. Obey Your Doctor. Just check us out. Friend us. Do all that kind of stuff that you do on Facebook and let us know what you think about it. Okay? All right. We're going to skip our Let's Talk segment tonight because we have a topic that is so important. I just want to get right into this topic and start talking to the professional that is here to tell us about it. The topic is sickle cell disease. And I have the perfect person to cover this topic from A to Z. His name is Dr. Trevor Lane, and he is a hematologist, oncologist. Big words. He'll let you know exactly what that means. But that's Dr. Trevor Lane. Thank you for coming in, Dr. Lane.
Thank you for having me again.
I'm just so happy that you could come in and talk about this topic because it's so important.
It is.
Especially for the communities that we serve.
Absolutely.
All righty. So the first thing, and just like always, I'm going to start off with this first question. What is sickle cell anemia?
Well, let's talk about what is anemia first.
Okay.
Anemia is essentially a low blood. And let me explain.
Mm-hmm.
In the red cells, there is a protein molecule.
Okay.
That protein molecule carries the oxygen.
Mm-hmm.
Oxygen is carried and that protein molecule. Now, when this protein molecule is low in concentration,
Right.
the word anemia is applied to it.
Okay.
Right? So anemia, essentially, patients use the word loosely, means low blood. Right?
Low blood count.
Exactly,
Yeah.
the low blood count.
Right.
Some people say low blood count, some people say low blood. But
Right.
that essentially is what is anemia. Sickle cell anemia is a very specific condition. It's a congenital condition. It's one that is inherited. You inherit it from your parents.
Okay.
And
So that's what congenital means.
that's what congenital means.
Right, that you inherit it from your parents. Right.
Right.
Mhm.
If your parents don't have any sickle cell disease or sickle cell trait or any other form of sickle cell, you will not have it.
Okay.
The data is that about 8% of African Americans have some kind of sickle cell trait, which is about 1 in 640 people.
Oh, all right.
So it is very prevalent in our society.
Okay.
And the thing that I think people have to know is that it is important that before having children, if there is any history in your family of anemia, or you heard your grandmother or grandfather said that someone had low blood,
Right.
that you get checked out to find out if you have the trait, mostly the trait.
Okay.
If you have the disease, you probably would know from the time you were a child.
Okay. Describe the trait from
What's
the
the
disease.
disease?
What do we mean when we say trait?
Okay, so it is an inherited condition. As you
Okay.
know, the normal person has 23 pairs of chromosomes.
Okay, so you have
Right.
23 pairs. So
of
you have,
chromosomes.
okay, so yeah, so
Right?
all right.
And on
so
that
46.
chromosome, you have the genes. The genes are marched along the chromosome.
Okay.
Right?
Mhm.
So essentially, this condition is inherited as a recessive condition, meaning that you have two genes from each parent in order to have the disease.
Okay.
So that means one of your parents either had to have the trait or the other one have the trait, or one have the disease and the other one have the trait. We'll go into the statistics in a while.
Okay.
But essentially you have to have two genes, one from each parent, in order to have the disease.
Right.
What happens when you have the disease is that the protein molecule that carries oxygen in the red cells, in a normal person, the red blood cell is kind of oval in shape. Okay. And the membrane is very malleable.
Okay, so it bends
and it moves.
It can do, and it's soft,
and it's soft.
It can
Absolutely.
go through the small blood vessels doing its thing.
That's correct.
Okay.
But whenever you have sickle cell disease, and to a certain extent sickle cell trait, the red cells become like a banana. It becomes oblongish. It becomes like a needle, and the membrane becomes very sticky. So what happens is that those cells stick to each other. They don't flow very well through your blood vessels.
Right.
And this is essentially what causes the pain and the issues with sickle cell. Now, what causes those cells to sickle, we'll go into it, is usually decreased oxygenation.
Okay.
When your oxygen level falls,
right,
then those cells sickle.
Okay.
And when they sickle, they become like a banana shape or a needle shape, then they would break apart, they would hemolyze.
Okay.
All right. And that's what hemolysis means.
Okay.
So essentially, that's what
we hit a few words there that we're going to definitely have to go back over that. So what we're talking about is that there are cells in our body called red blood cells.
Yes.
And they have certain proteins on them that help carry the oxygen around our body.
That's correct.
And without those proteins, then we're not carrying any oxygen.
That's correct.
And if we're not carrying any oxygen, we got low blood.
That's correct.
All right. So then basically with sickle cell, the cells are not, they don't bend and move and they can't squeeze through the little blood vessels. Like they are a little stiffer and different shaped. And they clump together.
That's correct.
And when that happens, if they can't get the blood cell through the vessels, then you can't get the oxygen to the tissues.
Absolutely.
And then if you can't get the oxygen to your tissues, then you got pain.
Serious pain.
Serious pain. Oh, gotcha. All right. Correct. Now we're talking. Now you talked about hemolysis.
Right.
Then you threw that one way over my head. All right. Tell me what is hemolysis?
Hemolysis is when, because those sickle cells, they become like oblongish, they become like a banana, and they stick together. Sometimes they just burst, and the contents of the red blood cells go into your system, like your bilirubin and all that stuff. This is why most patients with sickle cell disease, they would present with jaundice because of increased bilirubin in the bloodstream.
All right, you throwing all these words out, man. All right, so hemolysis is when the blood cell actually fractures and breaks.
Absolutely, yes.
Bilirubin is an element that's inside the red blood cell.
That's correct.
Bilirubin causes you to look yellow.
Yes, correct. It makes your
like your eyes, and if they turn yellow on you, the sclera, the white part of your eyes will turn yellow. Your skin, your palms of your hand will turn yellow.
Absolutely.
That's what you're talking about the bilirubin.
Yes.
Okay.
That's correct.
All righty. We getting there.
We're going there.
All righty. All right. Now, describe to me what a normal red blood cell is. I know that the sickle cell blood cell has either it has, well, let's step back. Type of hemoglobin that's in sickle cell is a S hemoglobin, right? Why don't we go through that a little bit before we get the other part?
In a normal person, you have what's called hemoglobin A, adult hemoglobin.
Okay, so that's if we say hemoglobin A, anytime in this show, that's normal hemoglobin.
Normal hemoglobin for normal adults.
That's a normal adult hemoglobin.
When you have sickle cell, you have what's called a hemoglobin S. And the reason why it's called a hemoglobin S is because there's a certain break in the DNA that causes an abnormal formation of the amino acids in that particular gene. So essentially, hemoglobin S is as a result of the DNA malformation that takes place. Remember, your DNA produces everything that produces the protein. So the protein is abnormal means that the DNA is abnormal.
DNA is normal. So let's step back. Since we brought up DNA, we're going to have to explain DNA. So DNA basically are all of those chromosomes and all of that kind of stuff that make up who we are.
That makes up a protein. It's like the blueprint, as it was.
It's a blueprint for us, everything.
That's correct.
So the skin color, how tall we are, how we look, how fast we run, all depends on our DNA.
That's correct.
So if it's going to make a red blood cell that has hemoglobin that has an S on it,
that's correct.
Then the DNA has to tell that the body, you're going to make that abnormal sickle cell hemoglobin. That's correct. All right. So that's what we're talking about.
That's what
DNA.
We're talking about. So essentially, in the sickle cell patient, you have, you could have two S, and that means you have two abnormal genes. So you have an abnormal protein, or you could have a normal one and an abnormal. Remember, you get each one from each parent. Right.
Okay.
So it comes in pairs.
It comes
so for
in
example,
pairs.
if you have a normal parent
Okay.
that has two A's, because it comes in pairs.
Right. So
and
two normals. The A, remember when we said a hemoglobin A and hemoglobin A, they have two of them, so both of their hemoglobins are normal.
That's correct.
All
In
right.
a normal person.
Normal person.
Right. So you have an abnormal person now with, let's say, 2S. They have sickle cell disease.
So they actually have the sickle cell disease because both of their hemoglobin
Right.
determiners are SS.
That's correct.
So they actually have the disease.
That's
Yeah.
correct. That means every child is going to have an abnormal S. They will not have the disease, but they will
Right.
have what's called a trait.
So a trait, let's step back now. So a trait, the child will have two hemoglobins.
Right.
One of them will be a normal from the normal parent.
Right.
And one of them will be an S from the
sickle cell
abnormal
parent. That's
parent.
correct.
So then a trait is, a person with trait has one normal and one abnormal. And that's the trait sickle
correct.
cell.
And the person with disease have both abnormal.
So a person with the disease would have a hemoglobin S
And a hemoglobin
abnormal
S.
and another hemoglobin S, and they actually have the disease of
correct.
sickle cell.
They have the disease. These are the
Okay,
ones that
gotcha.
get very sick
Right.
from childhood and require a lot of narcotics and have very low hemoglobins and need to be transfused on a regular basis. And these are the ones that we see most of the time in our practice.
Okay, all righty. Now, tell me about the pain. Where do they usually get the pain? And what I should start, you said hemoglobin A is adult.
Adult hemoglobin.
Does that mean that babies have a different type of hemoglobin?
Yes, they have what's called a hemoglobin F, which is a fetal hemoglobin. And I have to say something about that. Hemoglobin F, we all want to have that because what hemoglobin F does, it holds on to oxygen really hard.
Okay.
This is the reason why if you're on a plane and you listen to the announcements, they said if there's a problem, put your mask on first before the baby's mask. I mean, you would think that you'll put the baby's mask on first,
Right.
but you'll die before the baby because the baby has hemoglobin F.
Oh.
And they would hold on to the oxygen. If you listen to news briefings about tragedies most of the time, what would they find under the rock? They'll find a baby alive, but the adults will die because that baby's hemoglobin will hold on to oxygen much more than yours. So babies have hemoglobin F, which is something that you want to have a lot of because it holds on to oxygen much more than adult hemoglobin. And the one that does not hold on to oxygen, of course, is the sickle cell hemoglobin.
Yeah, so the hemoglobin S, the sickle cell, doesn't hold on to oxygen very easy.
No.
I mean, very strong.
Very strongly.
They don't hold on to it strong.
No, it does not.
Okay, all right. Excellent, excellent. So what I was talking about was that, and you had covered it. Now, for normal red blood cells,
Right.
how long does a red blood cell live normally? Because you were telling me that the sickle cell
hemolyzed.
red blood cell doesn't live as long.
Exactly.
Tell me
normal
about
red blood
that.
cell is about 120 days.
120 days.
It's about 120 days in your body. And the sickle cell can live much less than that, half, a quarter of that, depending on if the person has a crisis or not.
A crisis meaning that they had a flare and they had bone pain and all the pains and stuff like that.
That's correct.
And during those pain episodes, are the red blood cells, the sickle red blood cells breaking apart?
In some cases, they are breaking apart. It depends on the kind of crisis you have. If you have what's called a vaso-occlusive crisis, that's another big. But you described it very well. That's when the sickle cells stick together and they block the small vessels.
Right.
They occlude in it.
Right.
So it's a vaso-occlusive. Vaso is vascular.
Okay, the
So it's
vessel, vaso means the vessel.
That's correct.
The blood vessel.
And occlusive means
Occlusive means it's blocked up.
Right. So
Okay,
most
I
people
got
have
you.
vaso-occlusive crisis.
Okay.
So when they have those crises, that's when you get the most pain. I mean, there are other crises like aplastic crisis, a sequestration crisis, but most of the crises we see are vaso-occlusive crisis.
Okay.
That's when the patients, that's when the blood vessels are blocked and they get severe, they have no oxygen supply,
Right.
and they get severe pain, especially in the bones.
Okay.
Significant pain.
Sickle cell trait